Welcome back to Montana This Morning. The time now is 6:30. Dr. Erica from St. Vincent Healthcare is joining us on Zoom this morning with her beautiful backyard in the backdrop there. I thought it was a painting at first. So thanks for sharing your backyard with us this morning. And you're going to share some useful information. It is Women's Health Month, and so we're going to talk about some of the top concerns that women come in with. But I imagine that, COVID is still front of mind right now. So what do you say to them in regards to the COVID vaccination?
So, right, number one, in no particular order, but for women, one of the best things they can do for themselves right now, if they haven't already, is go out and get the COVID vaccine. That is going to help them reemerge into their pre-pandemic lifestyle and, help with a lot of the other things I'm going to talk about this morning, which are important for women's health in particular. So, yeah, if you haven't got your vaccine, go out and get it. You don't want to get COVID. We're seeing the long-term effects of that. It's still around for sure. So, get your COVID vaccine.
Yes.
There's number one.
Yes, wise advice there. And what about cancer screenings? Is that a common concern for women who come in to see you?
Oh, absolutely. And one thing that is really important to point out that makes 2021 unique, and after you get your vaccine and can reemerge, you really need to get back into your providers and get screened for any cancer screening that you may have fallen behind on during the pandemic. What we saw worldwide, and there's a slide that should be up that kind of shows that dramatically with that green line dropping down. That was in the Netherlands after COVID came about, and then after they went on their social isolation or they saw that the incidence of cancers dropped dramatically, and that's of breast cancer right there. And it's not that cancer stopped occurring, but it was that people stopped going in and getting checked and getting diagnosed with it. And so right now we are in this catch-up zone. So if you've been behind on that, we really need to get in there and get screened so that we can catch cancer early if it's there and prevent it as well. So think about breast cancer, cervical cancer with your pap smears. Talk to your provider about the signs and symptoms of ovarian and uterine cancer, and then obviously not just for women, but colon cancer screening if we are behind on that as well.
And something, I'm big on mental health and wellness.
1,000,000%. I mean, this is also Mental Health Month in May. And so I wanted to definitely highlight that. There's a campaign out there, hashtag stop the stigma or break the stigma. Mental health is prevalent. Difficulties with mental health is prevalent no matter what. But the COVID pandemic did not do it any favors. So we are really seeing still a lot of depression, anxiety, a need for support and stress management, a need for parenting support and stress management. So postpartum issues, are always a specific issue for women with depression and anxiety. And a lot of people suffer alone. And we really have a lot that we can do if you bring it up, talk about it, break the stigma.
Yeah, I like that. And what about cardiovascular disease?
Just a reminder that cardiovascular disease is also the #1 killer of women as well as men. So, also similar to the cancer that I talked about earlier, we saw a decline in a lot of people coming in and having heart catheterizations and having their stress tests. And if you have any signs or symptoms of cardiovascular disease, and as we've talked about before, women sometimes have different symptoms and signs. So get in there and get screened. Also, as we're all coming out of the COVID pandemic, I think people joke about their weight gain, their COVID-5, their COVID-20, their COVID-30. We all kind of fell behind on some of that. So the importance of healthy diet, exercise, good sleep hygiene, all of that translates to the mental health we talked about, the cancer we talked about, but definitely the cardiovascular disease risk factors.
And last but not least, I know some women might be concerned about their reproductive health, especially depending on their age and where they're at in life.
Absolutely. And so again, it's been a crazy year. A lot of people were nervous about being pregnant during the pandemic or getting pregnant after the pandemic or after they had the vaccine, which really, number one, I want to reinforce the vaccine is safe for people who are thinking of conceiving and if you are pregnant. So you need to, getting COVID infection would be much more severe. We need to catch up on our pap smears, like I said earlier, talk about STD screening and prevention, vaccination again, if you've fallen behind for yourself or your kids who can get the HPV vaccination. These are all important components to healthy reproductive health and healthy pregnancies and babies. So there you go for your 5 good topics for women.
Yeah, we always have something going on. Thank you so much, Dr. Erica. We appreciate your time this morning and have a good rest of your day.
Thank you.
Thank you. We'll be right back after this.